101. Which dietary change is most beneficial for a patient with PAD? A. High saturated fat intake. B. Increased fiber and lean protein. C. Increased processed foods. D. High sodium diet. Answer: B. Increased fiber and lean protein. Rationale: a diet high in fiber and lean protein helps manage cholesterol levels and reduce atherosclerosis progression in PAD. 102. Which laboratory test is most useful for assessing cardiovascular risk in PAD patients? A. Lipid panel. B. Complete blood count, CBC. C. Liver function test. D. Thyroid panel. Answer: A. Lipid panel. Rationale: a lipid panel helps assess cholesterol levels, a key factor in PAD development. The other tests assess different systemic functions. 103. Which non-invasive test evaluates blood flow in PAD patients? A. Pulmonary function test. B. Doppler ultrasound. C. Chest X-ray. D. MRI brain scan. Answer: B. Doppler ultrasound. Rationale: Doppler ultrasound measures blood flow in arteries, identifying blockages characteristic of PAD. 104. Which exercise should a nurse recommend for a PAD patient? A. Swimming. B. Supervised walking program. C. Sprinting. D. Heavy weightlifting. Answer: B. Supervised walking program. Rationale: walking improves circulation and reduces symptoms of PAD by promoting collateral vessel development. 105. Which symptom is an early indicator of PAD? A. Rest pain. B. Intermittent claudication. C. Gangrene. D. Cold, numb fingers. Answer: B. Intermittent claudication. Rationale: intermittent claudication is the earliest symptom, occurring due to reduced oxygen supply during exertion. 106. What is the primary mechanism behind PAD? A. Arterial vasodilation. B. Plaque buildup in arteries. C. Venous insufficiency. D. Autoimmune reaction. Answer: B. Plaque buildup in arteries. Rationale: atherosclerosis, characterized by plaque buildup, narrows arteries, reducing blood flow and causing PAD symptoms. 107. A patient with PAD is prescribed atorvastatin. What is the purpose of this medication? A. Lower cholesterol levels. B. Increase blood clotting. C. Reduce pain. D. Improve kidney function. Answer: A. Lower cholesterol levels. Rationale: statins like atorvastatin lower cholesterol, slowing atherosclerosis progression and reducing PAD risk. 108. A nurse is assessing a PAD patient. Which finding is expected? A. Warm, red skin. B. Hair loss on lower legs. C. Swollen legs. D. Brown skin pigmentation. Answer: B. Hair loss on lower legs. Rationale: PAD leads to poor circulation, causing hair loss, cool skin, and weak pulses in affected limbs. 109. A PAD patient reports nighttime leg pain. What is the best intervention? A. Elevate the legs. B. Apply ice packs. C. Keep legs in a dependent position. D. Restrict fluids. Answer: C. Keep legs in a dependent position. Rationale: lowering the legs improves arterial blood flow and relieves ischemic pain in PAD patients. 110. Which factor increases the risk of amputation in PAD patients? A. Well-controlled diabetes. B. Smoking. C. Low blood pressure. D. High protein intake. Answer: B. Smoking. Rationale: smoking accelerates atherosclerosis and worsens PAD, significantly increasing the risk of limb amputation. 111. Which factor contributes most to the progression of PAD? A. Low-fat diet. B. Smoking. C. Regular exercise. D. Drinking water. Answer: B. Smoking. Rationale: smoking damages blood vessels, leading to atherosclerosis, which worsens PAD progression. 112. Which clinical sign is most indicative of PAD? A. Bounding pedal pulses. B. absent or weak pedal pulses. C. Warm, flushed skin. D. Varicose veins. Answer. B. Absent or weak pedal pulses. Rationale. PAD reduces arterial blood flow, leading to diminished or absent pulses in affected limbs. 113. A patient with PAD complains of leg pain while sleeping. What should the nurse advise? A. Elevate the legs above heart level. B. Place legs in a dependent position. C. Apply cold compresses. D. Massage the legs. Answer. B. Place legs in a dependent position. Rationale. A dependent position increases arterial perfusion, alleviating ischemic pain. 114. Which symptom is not typically associated with PAD? A. Intermittent claudication. B. Shiny, hairless skin. C. Pitting edema. D. Cool extremities. Answer. C. Pitting edema. Rationale. Pitting edema is associated with venous insufficiency, whereas PAD symptoms include hair loss, cool skin, and intermittent claudication. 115. A patient with PAD is prescribed clopidogrel. What is the drug's primary function? A. Reduce platelet aggregation. B. Lower blood pressure. C. Reduce cholesterol levels. D. Treat infections. Answer. A. Reduce platelet aggregation. Rationale. Clopidogrel is an antiplatelet agent that prevents blood clots, improving circulation in PAD patients. 116. What should a nurse teach a PAD patient about foot care? A. Walk barefoot to improve circulation. B. Soak feet in hot water daily. C. Check feet daily for injuries. D. Trim toenails aggressively. Answer. C. Check feet daily for injuries. Rationale. PAD patients have poor circulation, increasing the risk of non-healing wounds, so foot inspections are essential. 117. Which diagnostic test is most commonly used for PAD assessment? A. Spirometry. B. Ankle brachial index, ABI. C. CT scan. D. EEG. Answer. B. Ankle brachial index, ABI. Rationale. The ABI test compares ankle and brachial pressures to evaluate PAD severity. 118. Which of the following foods should a PAD patient limit? A. Leafy greens. B. Processed meats. C. Fresh fruits. D. Whole grains. Answer. B. Processed meats. Rationale. Processed meats are high in saturated fats and sodium, which can worsen atherosclerosis and PAD. 119. A patient with PAD is at increased risk for which complication? A. Myocardial infarction. B. Osteoporosis. C. Peptic ulcers. D. Cataracts. Answer. A. Myocardial infarction. Rationale. PAD is caused by atherosclerosis, which also affects coronary arteries, increasing heart attack risk. 120. What is the primary cause of PAD? A. Autoimmune response. B. Atherosclerosis. C. Viral infection. D. Venous insufficiency. Answer. B. Atherosclerosis. Rationale. PAD occurs due to atherosclerosis, which narrows and hardens arteries, reducing blood flow. 121. A PAD patient should be advised to do which of the following? A. Avoid walking to prevent pain. B. Engage in regular exercise like walking. C. Keep legs elevated when sitting. D. Avoid drinking water. Answer. B. Engage in regular exercise like walking. Rationale. Walking promotes circulation and helps develop collateral blood vessels in PAD patients. 122. Which symptom suggests worsening PAD? A. Warm, pink feet. B. Rest pain and ulceration. C. Increased hair growth. D. Swelling with pitting edema. Answer. B. Rest pain and ulceration. Rationale. Rest pain and ulcers indicate severe arterial insufficiency, requiring urgent medical attention. 123. What is the primary function of statins in PAD management? A. Lower blood sugar. B. Reduce cholesterol and plaque buildup. C. Increase red blood cell production. D. Improve kidney function. Answer. B. Reduce cholesterol and plaque buildup. Rationale. Statins lower cholesterol, slowing the progression of atherosclerosis and PAD. 124. Which factor most increases the risk of PAD-related amputation? A. Uncontrolled diabetes. B. High calcium intake. C. Frequent hand washing. D. Adequate hydration. Answer. A. Uncontrolled diabetes. Rationale. High blood sugar damages blood vessels, leading to poor circulation and a high risk of amputation in PAD patients. 125. Which intervention should be avoided in PAD patients? A. Encouraging smoking cessation. B. Keeping feet warm and dry. C. Wearing tight compression stockings. D. Monitoring cholesterol levels. Answer. C. Wearing tight compression stockings. Rationale. Compression stockings can worsen arterial blood flow in PAD patients, increasing ischemia risk. 126. A nurse assessing a PAD patient finds an ulcer on the toe. What is this likely caused by? A. Venous insufficiency. B. Arterial ischemia. C. Fungal infection. D. High uric acid levels. Answer. B. Arterial ischemia. Rationale. Arterial ulcers in PAD patients occur due to poor oxygen supply, often affecting toes or pressure points. 127. Which condition is a major risk factor for PAD? A. Osteoarthritis. B. Hypertension. C. Urinary tract infection. D. Asthma. Answer. B. Hypertension. Rationale. Hypertension accelerates atherosclerosis by damaging arterial walls, increasing PAD risk. 128. A PAD patient reports pain relief when sitting down. What does this suggest? A. Worsening venous circulation. B. Improved arterial perfusion. C. Intermittent claudication. D. Neuropathy. Answer. C. Intermittent claudication. Rationale. PAD-related pain worsens with activity due to oxygen demand and improves with rest. 129. Which habit should a PAD patient avoid? A. Smoking. B. Eating fiber-rich foods. C. Exercising regularly. D. Keeping feet warm. Answer. A. Smoking. Rationale. Smoking worsens PAD by accelerating atherosclerosis and reducing oxygen delivery. 130. Which intervention can best prevent PAD complications? A. Weight gain. B. Controlling blood pressure and cholesterol. C. Decreasing fluid intake. D. Wearing tight socks. Answer. B. Controlling blood pressure and cholesterol. Rationale. Managing hypertension and cholesterol slows atherosclerosis progression, reducing PAD complications. 131. What is the most serious complication of PAD? A. Stroke. B. Gangrene and limb amputation. C. Chronic venous insufficiency. D. Deep vein thrombosis, DVT. Answer. B. Gangrene and limb amputation. Rationale. Severe PAD leads to tissue necrosis due to inadequate blood supply, increasing the risk of gangrene and amputation. 132. A patient with PAD experiences pain at rest. What does this indicate? A. Worsening arterial insufficiency. B. Normal aging process. C. Improved circulation. D. A healing response. Answer. A. Worsening arterial insufficiency. Rationale. Rest pain indicates severe arterial occlusion and inadequate blood flow even at rest. 133. Which group is at the highest risk for PAD? A. Young adults with no medical conditions. B. Individuals with controlled blood pressure. C. Smokers with diabetes and hypertension. D. People who exercise regularly. Answer. C. Smokers with diabetes and hypertension. Rationale. Smoking, diabetes, and hypertension accelerate atherosclerosis, increasing PAD risk. 134. Which statement indicates effective patient teaching about PAD management? A. I should smoke to relieve stress. B. I need to check my feet daily for sores. C. I should avoid exercising. D. I should keep my legs elevated while sitting. Answer. B. I need to check my feet daily for sores. Rationale. PAD patients have poor circulation, increasing the risk of non-healing wounds. 135. A patient with PAD is prescribed an exercise program. What should the nurse advise? A. Walk until pain occurs, then rest and continue. B. Avoid walking to prevent pain. C. Walk only once a month. D. Perform only upper body exercises. Answer. A. Walk until pain occurs, then rest and continue. Rationale. Intermittent walking promotes collateral circulation and improves PAD symptoms. 136. What is a major goal of PAD treatment? A. Improve venous return. B. Increase arterial blood flow. C. Reduce lymphatic drainage. D. Promote edema formation. Answer. B. Increase arterial blood flow. Rationale. PAD treatment aims to enhance blood flow to affected limbs, preventing complications. 137. Which food should a PAD patient avoid? A. Fried foods high in trans fats. B. Fresh vegetables. C. Lean proteins. D. Whole grains. Answer. A. Fried foods high in trans fats. Rationale. Trans fats contribute to atherosclerosis, worsening PAD. 138. What is a common site for PAD-related ulcers? A. Inner ankle. B. Toe tips and pressure points. C. Shin bone. D. Knee joint. Answer. B. Toe tips and pressure points. Rationale. Arterial ulcers form in areas with poor perfusion, such as toes and pressure points. 139. Which symptom suggests acute arterial occlusion in PAD? A. Sudden, severe leg pain. B. Gradual swelling. C. Red, warm skin. D. Increased hair growth. Answer. A. Sudden, severe leg pain. Rationale. Acute arterial occlusion blocks blood flow, causing immediate pain and ischemia. 140. What medication is commonly used to improve walking distance in PAD patients? A. Cilostazol. B. Metformin. C. Omeprazole. D. Insulin. Answer. A. Cilostazol. Rationale. Cilostazol improves blood flow and reduces claudication symptoms in PAD patients.